to teach us how to live. Muhammad, Ya Rasulallah, you were so caring and kind.
As well as Dr. Halima ALIMI. She's going to be giving us a health talk on glaucoma facts. Dr. Halima ALIMI is married to Dr. Mustafa ALIMI. She is an ophthalmologist. She's the CEO of An-Nur Eye Center, Surulere. She belongs to the body of Muslim professionals that have always supported AIC, MICA, and other Muslim bodies to propagate the deen of Islam. May I welcome Dr. Halima ALIMI to the podium to give her talk. Assalamu alaikum, ma.
A'udhu billahi samil alim minash shaitani rajim. Bismillahir rahmanir rahim. Ashhadu an la ilaha illallah wahdahu la sharika lah wa ashhadu anna Muhammadan abduhu wa rasuluhu. Wassalatu wassalam ala al-ashrafil anbiya wa mursalin sayyidina Muhammad sallallahu alayhi wa sallam wa alihi wa sahbihi wa sallam. Assalamu alaikum wa rahmatullahi wa barakatuh. Okay, this evening we're going to be talking about some facts about glaucoma. Glaucoma is a topic that's, well, I don't want to call it overflowed, but we've been talking about it, and yet we don't see much of an impact. It's a potentially blinding disease, and we keep seeing people going almost irretrievably blind from it, and yet we don't see people getting panicked. I mean, if there was a lion around the corner, everybody would get panicked and run. But this glaucoma can totally deprive you of your life, can render you totally blind, and yet everyone is so complacent. So we can only do our best and keep talking about it. So we're here again to talk about glaucoma. I know I talked about glaucoma right here maybe 2 years ago, but we can talk about it again, remind ourselves about what's really important. Okay, slide please. Right, so let's talk about what it is. It's a quiet but ultimately devastating disease of the nerve of the eye. So we all know that at the back of the eye we have a nerve that connects our eyes to our brain, and that's what takes messages back and forth. So when you look at something, it just basically the light from that object enters the eye, and then it's still the nerve that takes the message to the brain. Then your brain tells you what you're seeing. So if your brain doesn't tell you what you're seeing, you still can't know what it is. It's potentially blinding, and glaucoma is a disease of this nerve that connects the eye to the brain. Glaucoma is potentially blinding and is deceptively silent, and that's why people are so complacent about it. That a lot of people come to us when they're already seeing that things are blurry. By then you've lost almost everything. So it's silent in the beginning, and we need to know that this is it, and it's irreversible. So once a person is gone blind from it, that's it. There's nothing you can do. So it's very important. Right, how does the damage happen? It starts with eye pressure. Now, whatever eye pressure that person has is too high for the eye. The eye is not enjoying the pressure. So when the pressure in the eye is very high, it doesn't allow blood to flow. Because if we know about the heart, a bit about the circulation of blood, we know that the heart is like centrally in our chest, then it keeps having blood vessels that keep branching. The biggest vessels are the ones near the heart, then smaller and smaller branches keep branching out. So what happens is our blood needs to flow to our eye in this direction. Pressure works in the opposite direction. So there's an amount of pressure you can have in the eye, so it dams back the blood that is supposed to be coming forwards into the eye. So that nerve is starved of blood. It's like you having no food to eat. I mean, we're all fasting. We know how we felt in the morning. We know how we're feeling now. So if your nerve has no blood to use, it's going to get progressively weaker. So when this damming back happens of the blood flow to that nerve, it starts to get damaged because it's starved of blood. That's the only way it gets its nutrition. It's starved of blood, and it slowly dies away, and then it finally leads to loss of vision. So this is how eye pressure is related to our vision. Right, so this is a normal eye. If you were to slice the eye this way and you are looking through the side, a side view, this is what you would have. So that nerve right at the back, in a normal eye, no problem. In that eye, there's a lot of pressure, and you can see the arrow going backwards. So blood cannot flow forwards into the eye, and that's what causes the damage. Next slide, please. Okay, perhaps, is it possible for the lights to go off? Because, can the lights go off? Can this place be a little dimmer so that people can see the picture? Is it possible? When we look in the eye as clinicians, this is what we see. This is what we see at the back of your eye when we look inside the eye. The very back, that circular area at the back, you see those things like looking like strings. They're blood vessels. That's where the blood comes into our eye. So the blood comes behind, and it's like back of the in eye, and it's not nerve. You can see that where those vessels are coming out is nice pink. Next picture. So that happens when you have high in the eye. Eating, and like a cup. When you look at it, we call it cupping. It's like putting a saucer, like this saucer you use to drink tea or something. Like putting a saucer right there. It's cupped, it's eaten into, and white. White because there's no blood. The pressure has driven back all the blood. Okay. Right. So what are the causes of glaucoma? It's mainly hereditary. I keep saying that. The majority of glaucomas are hereditary. And when I tell patients this, they tell me, no, nobody in my family ever had this. How do you know? It's a silent disease. And there's no particular, when you inherit it, or if a person inherits it, there's nothing, we don't know what determines when a person will develop it. Only Allah knows what the determinants are at this point in time. That if I've diagnosed glaucoma in a child before the parents that the child inherited the disease from. So this person developed it as a child, whereas the person that passed down that tendency to him didn't manifest it till age 60. So it's ill understood. I mean, like I said, we only have what little knowledge Allah releases to us. So far, we don't know why it's like that. So you cannot categorically say that just because you don't know that somebody already has it in your family, then you disbelieve that it's hereditary. Again, it's a silent disease. So even the person that has passed it on to you is right there, it may not have manifested yet. Person is still going through the silent phase. When we see about the phases of it, you see what I mean. And then this is Africa. I've known of families where they now began to look back and say to themselves, okay, hang on, there was one uncle somewhere they knew who was using loads and loads and loads of drops and things, had surgery, had very poor vision, but he never declared what his problem was. So this is Africa. There's a bit of fetishness to our beliefs because of the kind of things patients say when they come to the consulting room. Sometimes when they tell you their story, you can see they're already pointing a finger to somebody in their family, somebody or the other caused it. So because in Africa, we think that somebody must have caused it, we keep quiet, we say nothing, don't declare your problem, it's your personal history. So these are all the various reasons why you may not already be aware. Of course, the other reason we may not be aware nowadays is because the extended family structure is breaking down rapidly, and a lot of people don't know their extended family very well. So these are the main reasons why it's not obvious to us that it's hereditary, but it is. Injury can also cause glaucoma. Injury to an eye. Inflammation, that means the eyes are red. The person doesn't go, he decides it's Apollo. He goes to a chemist or something, or just self-medicates instead of going to hospital. Not all red eyes are just Apollo. Sometimes it's an inflammation that can later on, because it wasn't properly treated, can later on lead to glaucoma. Drugs, steroids. Now, either you have a person who has a disease that people who itch, we use steroids sometimes to control the itching, but we use it judiciously. If you don't watch the way you're using it, if you overuse steroids, it can cause glaucoma. Some patients would come, get the drugs from you, they won't come back. They subsequently keep going to the pharmacy and buying the drug and not knowing that it can cause that, which is why we always tell people, always check with your doctor. Don't use drugs in any manner. So that's one group of people that can develop glaucoma from steroid use. Another group is young men, especially undergraduates. We've seen them, they're trying to develop muscles since they believe that, that makes them look good. And they're lifting weights and they're using prednisolone. They're taking steroids because it's anabolic. It helps you to grow muscles. And not knowing that, it has several other effects, one of which is glaucoma. So sometimes we see that group also coming with glaucoma. Glaucoma can be congenital. Congenital means anything you're born with. So it has no age discrimination. You can have a brand newborn baby born with glaucoma, but that's not really the hereditary type. That one had a developmental problem. The eyes didn't develop properly from inside the womb. Yes. Right. This is a congenital glaucoma. So you can see this child, you can see the way the eyes are. This is not normally how a baby's eyes would look. Two things are strange here. One, the eyes, you can see the black is large, big. The eyes are soft. So when there's pressure, it's like putting too much air in a balloon. Because a baby's eyes are soft, if they develop pressure in the eye will balloon out and be bigger than usual. So we call it, in medical terms, we call this ophthalmos. Boof is like a bull. So bull's eye, like a cow's eye, will be really large. And then you can see the black is not black. It's hazy. It's looking slightly whitish because there's a lot of water in it because of the excessive pressure in the eye. So this is a newborn baby that has glaucoma already. Okay. Now, what's the current situation? Why are we making so much noise about glaucoma? It's because it's the second leading cause of blindness in the world. It used to be number 3. Now it's number 2. The commonest is cataract. Glaucoma is the second leading cause. It affects in the year 2002. That's like 11 years ago. WHO estimated that more than 66 million people were affected in the world, and they thought that figure will double within a decade. So this is more than a decade later. So we probably this hasn't been updated, but I can imagine that it's way over this figure. And 6.7 million people were blind, and it has been projected to increase. Okay, please, I've been asked to announce that all children should please be taken out for deworming. There's a team outside giving dewormers. So you know children should have regular deworming. So there's an opportunity now to deworm your children, but right outside. And go now, please. So it's been projected that this figure will increase over time, both the number of people with glaucoma and those who are going blind from it. And the health costs in the US, they have taken the trouble to calculate the health cost. What's glaucoma doing to them financially? And they found out that they lose as much as $1.5 billion every year in health costs because of glaucoma, both because of hours lost at work and because of money spent on medication and all sorts of therapies. And even in Nigeria, it is also the second commonest cause of blindness, the first still being cataract. But you see, it's distinctly different from cataracts. Cataract blindness is reversible, totally reversible if it's just cataract. Person has a cataract and is totally blind from it. If you do a cataract surgery, you restore vision. Glaucoma is not like that. So if you're talking about blindness as a whole, you can categorize glaucoma as second commonest. But if you want to qualify it properly and talk about irreversible blindness, definitely glaucoma is the king of that, is the first for irreversible blindness. Next slide, please. What are the symptoms at first? People would often ask me, doctor, how would I know if I have glaucoma? The first thing is absolutely nothing. For a good 3 or even 4 years.
All praises and gratitude is due to Allah subhanahu wa ta'ala, the controller of all affairs. Admonition Islamic Center hereby expresses solidarity with Nigerians at this critical moment of our nationhood due to the scourge of COVID-19 globally. We especially feel for the Muslim Ummah, who from all indications will have to start the 2020 Ramadan season in complete lockdown. There won't be Taraweeh, no physical tafsir sessions, no joint iftar, no itikaf, and possibly no Eid al-Fitr prayers. For the same reason, the AIC is supposed to be 10 years this year, and arrangements have been concluded to feature 10 guest speakers for 10 hours at the prestigious National Art Theatre Igomu, Lagos on Saturday 2nd May 2020. But by Allah's will, it will not hold again. We take solace in the fact that Allah is the best of all planners and He alone knows best. We beseech Allah to spare our lives till next year's Ramadan 2021, inshallah. We pray for Allah's forgiveness, that Allah heals the world, put an end to this pandemic, and give us the privilege to be together for His sake again, to witness more Ramadan in good health. Ameen. Inshallah, our focus this 2020 Ramadan in our own little way is to provide foodstuffs to the fasting Muslims who are in need. May your rewards be great with Allah as you join us to make this dream a reality. For inquiries, call 0802-335-5870, 0808-690-5870, or 0708-378-7920. Account details: Admonition Islamic Center, Bank, Sterling Bank, account number 050-021-1796. Lukman Adekombi for AIC. Ramadan Mubarak.
Ramadan, Ramadan, ya Habib.
Next slide, please. What are the symptoms at first? People would often ask me, doctor, how would I know if I have glaucoma? The first thing is absolutely nothing. For a good 3 or even 4 years, this person is unaware that there's anything going on. So a lot of people are going around comfortable that they're fine, whereas they're slowly developing this problem. Now, by the time the person now begins to see that the images are blurred, people will commonly say, oh, it's smoky, it's cloudy. By then, they've lost almost 70% of that nerve is already gone. And the damage, when it's severely reduced, when they now find out that they can no longer see things beside them, they're now bumping into objects that they should have seen, by then almost 90%, and eventually blindness. Pain is very uncommon. I need you to know that. If your eyes are aching you, look for another cause. Not likely to be glaucoma. So don't think that you will have an eye ache to tell you that you have glaucoma. The same way people erroneously think that if they have hypertension, they will have a headache. It's not that. We always tell people, by the time you're having a headache, something bad is about to happen. If it's hypertension, you're probably about to have a stroke, or something is about to happen. So the disease itself does not give you that. Same thing. Glaucoma doesn't give you eye ache. Oftentimes people will come and say, my eyes are aching. I need to check my eye pressure. I think, well, it's good to check your eye pressure, but I can already tell you it's not glaucoma making your eye pain. There are very few glaucomas that cause eye pain. They're not common in our environment. They are commoner among the Orientals. Right. Now, this is what you see, with a person who has glaucoma. If a person whose eyes are normal, if a person looks at two boys, holding balls, this is what they would see. Picture on your left. However, when you now have glaucoma, if the person has glaucoma and the vision is, slowly going away, that's the kind of view they have. That's why I'm saying they keep bumping into objects. If you were to navigate, you want to walk, you know that there's a row here and a row here because you have a wide field of vision. But when the field is reduced, they would have bumped into the object before they realize, okay, there's something at the side. So that's what glaucoma does. But that process is a very slow process. But this is end stage. This is the end of it, really, the picture on the right. By the time it gets to the end, this is the sort of thing before it finally becomes totally dark. But in the early stage, it looks like this. But I'll tell you, that whether the person is normal or has early glaucoma can look like that, because early glaucoma is not yet obvious. Right, or like that. Someone trying to look at a fountain or something, you can see that everywhere else is dark. It just has that central area. And this is, not the end. The end, everything is extinguished and it's totally dark. What are the factors that we consider as high-risk factors for glaucoma? Family history. If you know you have a family history, you're at risk. Short-sightedness. If you're short-sighted, you're at risk. If you're diabetic, if you're hypertensive, if you're over 40 years, if you're of Afro-Caribbean descent. So we all have a basic risk. Glaucoma is commoner, more blinding, more aggressive, occurs earlier in people of Afro-Caribbean origin as compared to other races like the Caucasians and the Hispanics, who seem to have more of it. Injury can predispose the person. And then, of course, high eye pressure. High eye pressure we put there because we have patients whose pressures are high when you measure, but when you test them, you don't see any damage yet. But such people are at risk. Anytime the pressure can start damaging. So we keep them close and keep monitoring. Now, let's not get deceived by these lists. This is a list of the common risk factors. There are many people who have glaucoma who do not fall into any of these categories. Indeed, some of them might even be long-sighted instead of short-sighted. They may not have a family history that they know about. So don't think just because you don't fall under any of these categories, you are safe. Right now, the current thinking about glaucoma is everybody. Screen your eyes. Everybody. Okay, next. Right. Medical treatment. What kind of treatment do you get when you have glaucoma? It can be medical. They can have laser procedures. It can be surgical. It can be a combination. The doctor is the best person to decide. The ophthalmologist is the best person to decide what modality of treatment will suit you best. And then it's important to know that treatment is for life. You don't stop. Just like treating hypertension or glaucoma. So it's really, you're on the medication or on the treatment, it's controlled. If you go off it, more damage happens. And then, yes, so that's what I just said. Default results in more damage. And damage is irreversible. Okay, next. Prevention. How can you prevent glaucoma? You cannot prevent it. It's all down to destiny. So destiny will inevitably take its course. It's the blindness from it that we keep arguing about. That you can have glaucoma, but you don't have to go blind from it. If you find it early, you treat it aggressively, with dua, with Allah's mercies, you shouldn't go blind. But if you sit down, do nothing, and wait to now start having foggy vision, then you haven't helped yourself. So you cannot prevent glaucoma itself, but you can prevent blindness from glaucoma. So your best chance is the early diagnosis, that you accept the diagnosis, because that's another problem. Oftentimes people come to me and I say, well, you know, from my evaluation, you have glaucoma, especially the non-Muslims. I reject it in the name of Jesus. There's a problem, because that person is slowly losing it and saying they reject it, they are waiting for their miracle. I think the fact that you found the diagnosis before it made you blind in itself is a miracle. It's a chance that you do not go blind. But accepting the diagnosis is a problem. You know, even for the Muslims, oftentimes they tell them, they may not even believe what you're saying, because at times I give medication and then the patients don't use the medication. They come back and tell me, somebody somewhere, one alternative medical practitioner says that if I eat a lot of garlic, it will be alright. These are the kind of problems we face and, you know, part of the reason why we're finding it so difficult, you know, with patients. And then, so if you find it early, you accept your diagnosis, you go for aggressive and compliant treatments, and you follow up regularly. Because even when you use things like medication, oftentimes, anyone who has gotten used to taking a tablet of Valium to sleep will tell you that after some time, one tablet doesn't work any longer. You now have to double it to get the same effect. So the body sometimes develops what we call tolerance. So if you're using a particular drop and you're doing well, don't get comfortable and say, okay, that's it, that's my drop, and disappear for years. You still have to go for regular checks in case the drug all of a sudden doesn't give you as much of an effect, so that you can switch to another type of drug which will then give you a better effect. So it's important to follow up. And dua. What can we do without dua? I mean, so it's you see two people with glaucoma, one of them does so well, the other doesn't. Sometimes, you know, we're just in need of Allah's mercies, really, to be able to get through these things. And then what we should be doing, our own bit, is that we should have 6 monthly glaucoma screening. That is the ideal. That every 6 months you have a comprehensive glaucoma screening. However, a lot of people find it difficult to keep this schedule, either because of time or because of, I don't know, maybe financial considerations. So once a year, worst case scenario should be that once every 12 months, you have something to show for that year about your eyes. And it must be at an ophthalmologist. An ophthalmologist is the only one who has the training to recognize. If you do not know what you are looking for, it will be there, you won't see it. You have to know what you are looking for, and only the ophthalmologist has that training. So if you go to an optician, you go to an optometrist, you can't be sure of what you're getting. So usually I tell everybody, why join the statistics? So take yourself out of the glaucoma statistics. Don't join them. You should have a glaucoma screening today. Don't join the glaucoma blind. Okay? So that's my message to you today. Yeah? Right. So thank you for listening. Wassalamu alaikum wa rahmatullahi wa barakatuh.
Peace be upon the messenger, the chosen